Okay, good afternoon. I'm here today to talk to you about Fit for Work, which is a new service. And the purpose of this webinar is to really introduce the service to GPs and anyone else who may be interested in learning a bit about the service. If you are a health manager or a personnel manager, it may also be helpful for you to tune into the website, because there may be some additional helpful information for you there. But starting with GPs, so I actually work as a GP, and I'm also involved in leading the national engagement program with GPs on what I think is a very exciting new service. And the purpose of this webinar today is to really sort of cover three core areas, which is what is a Fit for Work service, why do we need it, and how we hope it will add value to your practice as a doctor. So this is the official sort of government strapline, if you like, on Fit for Work, and what they're saying is that Fit for Work is a line of support for GPs, employers and employees, and it's ultimately there to help people to get back to work. Now, I suppose the natural sort of next question is, well, why do we need a service like this? Well, is it something that's going to be useful to me as a practicing GP, and is it going to be useful to my patients? Which I think is a very fair question. And these are the stated objectives of the service, which you can see on the slide that's currently being displayed. Ultimately, the objective of the service is to address the negative impact of sickness on the state, but that shouldn't be viewed as just addressing the impact on sort of costs and benefits and what have you. There is also a very real and damaging impact on the individual, on the patient, as well as demands that are placed on the health service. And hopefully what this service is offering is an opportunity for us to better manage and support people ultimately who are in a situation where they've developed an illness which is potentially affecting their ability to work. So the objectives of the service in the wider sense are to really offer some expert support to general practitioners. Many general practitioners have, in various studies which have been done over the years, and whenever I certainly personally speak to GPs, will tell you that they either have no expertise in occupational health, or if they do, they don't have the time to really sit down and drill down into the challenges facing their patients. And this service, I think, will offer that, an independent expert opinion and the time to do it. And we'll talk a bit more about that hopefully a bit later on in this webinar. Also, I think another aim of the service is to actually reduce the length of sickness absence, because we know that if people are who are in work become sick or take a period of time off, if they don't achieve or receive appropriate advice in a timely manner, instead of being off for 1 or 2 days, they risk actually being off for a longer period of time. And generally speaking, that may not be helpful to the individual. And also means that they come back to see the GP on multiple occasions. And if this isn't, if positive actions aren't taken to support the person, then the person is in danger of becoming long-term sick, which isn't good for the person, the patient, and means that they will be taking up a lot of general practitioner and hospital time for no good result, sort of ultimately to be achieved. And there is also an aim of trying to increase the understanding of work as actually something that's good and positive, because the majority of studies which look into this area and the majority of experts who study this area are in agreement that, generally speaking, for most people, work is a good thing. It just has to be managed in the right sort of way, and the person needs to be supported to for it to be positive. Okay, so we're going to move on and we're going to talk about what the Fit for Work service is, and also I'll talk a little bit about what it may not be. So the Fit for Work is a centrally funded initiative. The Department of Work and Pensions, with positive support from NHS England and the Department of Health, among other agencies, has decided to launch the service. And as I said, it's really designed to support GPs, employers and employees. Now, it is the first attempt at a policy level at having a national occupational health service, which I think is important, because the majority of people who are employed in the UK economy, and that's about 70 to 80% of people, currently have no access to any form of occupational health service. And this is because they tend to work for small and medium-sized businesses where there isn't the capacity to provide it, which means that if you work for a small and medium-sized business and you become unwell, you'll go and see your GP, or you may go and see the hospital to treat your illness, but often there isn't the advice that you need available in terms of, well, how does this impact now on my ability to work? And I think this service fills that gap, because traditionally what's happened is when people are in that situation, they'll go back and see their GP, and of course, as we mentioned, often the GP doesn't feel that they're in the best position to provide appropriate advice when it comes to employment. And similarly, if you're an employer and you're trying to find advice to support your employee coming back to work, you're in a similar situation. And I think this service provides, some positive advice in that sense. The service is constituted of 3 bits, or 3 elements, if you like. There is an advice line, which anyone can ring up and get general advice from an occupational perspective. There is the assessment bit, or the medical consultation bit, and this is the referral bit where an employer or a GP would refer a patient or employee, whichever term you prefer, into the service, and that's for them to specifically get an assessment and some advice targeted at them in the context of their specific employment. And there's also a website, which is again an open source website, which has domains there for employer, employee, and GP, and that again you can access for useful advice and information. There's some good blog content on interesting and topical subjects, such as you develop diabetes, or somebody with cancer and you're wondering about how that might impact on work. And officially, the Slide Says This service launched in 2014. It started its rollout in 2014. It officially launched in March of 2015, and we've now completed the rollout, and the service is effectively fully operational in England and Wales. By that I mean employers and GPs are now able to refer into the service, and if you're an employee or somebody who works in an organisation you think you may benefit, by all means speak to your employer or your GP about the possibility of a referral into the service. So, moving on, how does the service work? Basically, from a doctor point of view, because we're talking about this from a general practitioner perspective, if you're a GP and you see a patient who comes to you, in order to be referred into the service, the patient has to have a job. That's the first thing. They need to have a job, and it's a voluntary referral. So the patient comes to see you, they've got a medical problem, such as they've developed back pain, they're in employment, you speak to them, you make your clinical assessment of the patient, and you will hopefully treat them appropriately with medication and advice. And at that point, you have a discussion with the patient. The patient tells you that they, for example, are a heavy manual labourer, and you think, okay, can they really go back to doing that job with the back pain? So you may advocate or prescribe a period of rest. Now, that's entirely reasonable, and you may, as a result of advocating a period of rest, decide to give them a period of sick leave, which again is entirely reasonable. And you may go for 1 or 2 weeks. Now, when you do that, what we're asking is that you consider whether this person may be at risk of being off for a longer period than that. And if you do feel that is the case, please refer them into the service. What we know is that patients who are referred to the service in the first 4 weeks are more likely to be successfully returned to gainful employment than people who are left without any interventions for a longer period of time. So what I'm saying is that, what the data shows is that if you're off work for 4 weeks, we know that your chances of going back to work drop a little bit. But if you are allowed to stay off work for 6 months, statistically the chances of somebody returning to work rapidly approach 0, which means that somebody who is off work for 6 months is highly unlikely ever to go back to work. Now, that's quite significant. If you're a 25-year-old guy or girl, and you've you're in your second job at the beginning of your career, and you're in this sort of situation. So obviously this is something that we want to avoid, because we know it's not good for the individual, or good for sort of wider society, or indeed the health system. So that's the sort of person we're asking, please refer into the system. Once you've made your referral into the system, within 48 hours the person will be contacted, the patient or employee, will be contacted by the service, by one of our occupational health experts, and they will undergo a 45-minute assessment. That's a 45-minute assessment which looks at this biopsychosocial, or follows rather this biopsychosocial model, and is really exploring factors, from the physical, psychological, and social domains, which may be impacting on somebody's ability to work. Because what we do know is that the majority of people who present with episodes of sickness absence, it's very rarely an isolated physical thing, often, or even a mental thing. It's often a myriad of things that have sort of piled up together, and which then compromise somebody's perceived ability to work or remain in employment. Perhaps they're in debt, they're having marriage problems, and they're also being bullied. And then they may manifest with physical symptoms like back pain, which may or may not be the primary cause of their reason for seeking a period of sickness absence. So it's important that we drill down and find out exactly what the issues are, and once we've identified those issues, that we're able to provide the appropriate support. So the assessor will do that. The assessor will make this biopsychosocial assessment. They'll have 45 minutes to really drill down and explore the patient's physical health, mental health, social circumstances, employment circumstances, and a lot of detail which most of us in general practice just don't have the time to do, unfortunately, at the moment. And once they've made that assessment, they will then come up with a plan called the return to work plan, and they will also agree with the patient a date by which to aim to get them back to work. Now, we know that the process of producing the return to work plan is in and of itself helpful to the employee, and it also supports the employer in terms of, well, what reasonable adjustments might I need to make to help support my person back to work and to keep them in work. So the return to work plan is produced for that reason, and we've also said that we will agree a mutually convenient date with the patient or employee by which they should aim to return to work. Now, this isn't a punitive date. This is not saying by 2 weeks from now you will be back in work. This is saying let's aim to get you back to work for 2 weeks from now, and these are the interventions and support mechanisms we will try and put in place, and that's exactly what will happen. So we agree a date, we produce a return to work plan. Doctors, you should also be aware that once a return to work plan is produced at a statutory level, the patient does not require a sick note for the period that they're in the service. So you should not be required, you should not have the patient reattend requesting a sick note, because they can present the return to work plan, the fit for work plan, to the employee if they choose to, and that will be recognised as a fit note. So hopefully that should reduce your workload a little bit. Now, this diagram which I've flicked to shows the referral process in broad brush. As I said, it's GPs or employers now who can refer into the service. The whole process does require the consent of the person being referred into the service, and it also sort of shows what the end product of the service is, as I've highlighted. Now, when the person is referred into the service, if the patient's case is complicated, or the health professional who is making the assessment of the person's case feels that they need additional advice, and there is a mechanism within the framework of the service to get additional advice. Our advisors work in teams with occupational health nurse specialists, mental health nurse specialists, physiotherapists, and occupational therapists, sort of all working together, and they are overseen by a chief nurse and a consultant in occupational medicine. If they feel that additional input is required, then they can by all means refer the case for this additional team input. The other thing from a clinical perspective is that the entire framework of the service there is a very strong clinical governance framework for the service, which follows the CQES clinical audit criteria, which is a quality standard set by the Faculty of Occupational Medicine in terms of what good quality occupational health service should look like, and our case managers and the output from their consultations are continuously audited to ensure that there is sort of quality very much at the heart of what we're doing. So what are the anticipated benefits? I've kind of touched on some of these, but we can go back and have a look at them. So the potential benefits are that we provide an expert occupational health advice, which has not been there previously, which means that hopefully patients are optimized in maximizing the chances of successfully returning to work from a period of sickness absence. From a general practitioner point of view, I would view it as an opportunity to practice holistically, because as doctors we very seldom are able to influence the wider economic factors, the wider social determinants of disease and ill health. We can't create more jobs, we can't improve housing and education, but what we can do is, if we can successfully support people in retaining gainful employment, then that is actually a very strong determinant of good health, not only for the individual but for their family. And I'll tell you a bit more about that possibly in the next slide. Now, in addition to that, I think the service allows us to preserve the advocacy role of the GP and the doctor-patient relationship, because it takes away from the doctor in some ways the requirement to have to confront a patient about issues of employment, which can sometimes be tenuous or difficult issues to talk to a patient about, depending on their circumstances. And I think in that sense it's very empowering, because in the course of a skillful consultation, signposting a patient to consider the Fit for Work service would be potentially a good thing. And then let us provide, with the time that we've got available, as opposed to the 10-minute consultation, 45 minutes, really drill down, really explore the patient's needs and wants and expectations, and really try and find a positive solution to it. As I said, the service takes away the requirement for fit certification while the patient remains in the system, and ultimately I think as a result of that should reduce your consultation rates. And we also think that if patients are kept in employment and well supported in employment, that should lead to greater patient satisfaction, because generally speaking we know that people who are in gainful employment are happier and are healthier, have low levels of sort of major disease comorbidities like obesity and cardiovascular disease. They have a sense of identity, low levels of anxiety and depression, etc. So your patients should be happier and they should be consulting you less, is what we think should happen, certainly in the short, medium, and longer term. Okay, and I've touched on this earlier, and this is a particular area of interest to me. Ultimately, I think we know that unemployment perpetuates poor health, and if we can successfully keep our patients in employment and support them back into employment quickly, we know that this should stop these patients' quality of life deteriorating, which is associated with unemployment, because we know also that unemployment condemns people, not only individuals but families, to a cycle of poverty. It certainly exacerbates inequalities in our society, because if you're not working, your position and status in society as an individual and as a family can fall, and as a result of that, other social injustices are perpetuated. And we know that the children of people who are unemployed tend to also have worse health outcomes. So there's an intergenerational effect. And if you look at the work of people like Professor Sir Michael Marmont, a very eminent professor of public health who writes on these things, there are very powerful arguments for keeping people in employment and thereby protecting not only them but their families from the negative effects of poverty. And as I've mentioned, there should be wider benefits for society and the state, because ultimately we hope the service will grow in awareness among the general population as well as among clinical medical people about the general benefits of work to health. Speaking at the moment, there are over 130 million days lost to sickness absence every year, and this has a negative impact, as I've said, on the individual, on employers, and on the state. And it's estimated that employers would save 100 million a year in sick pay costs through Fit for Work, with an increased economic output of 150 million. So some fairly compelling arguments, I think. That ends my presentation to you, my webinar presentation to you on the Fit for Work service. We're more than happy to take questions, and these can be directed through the Fit for Work advice line in the first instance, or by emailing us, and we can try and hopefully get you some answers to that. So with that, I say thank you very much, and good luck with it. Please do engage with it. Please refer into the service. We look forward to receiving your referrals. Thank you.